we need to talk a little bit about what language can we use so that we remain therapeutic, I guess. And so I've sort of developed these, I don't know, I guess 9 golden rules or something. You can call them what you will, but these sort of tried and true little bits that I've kind of clung to over time that have made this work on those really frustrating days sometimes a little bit easier. And so one of those ideas to share with our interdisciplinary partners, school nurses will use as this example again, given the survey data that I talked about, is to acknowledge that symptoms are real. It seems very simple, but again, if we assume that sometimes 3/4 of people think kids are faking or think they need attention, this is something that needs to be said and probably needs to be said multiple times. And so oftentimes people will ask me, that I'm interacting with, well, how do I do that? Well, first and foremost, we just simply want them to avoid dichotomizing. This is not either a medical problem or a psychological problem. What we say to parents, what we say to my medical colleagues, what we say to schools, it's always both. It's neither either or. It's always both. And so hopefully giving folks some words to use around that makes that a little bit easier. We know that the data is clear that families, and it would stand to reason that other care providers, those that embrace a multidisciplinary conceptualization for these children's symptoms, they have better outcomes. And so it's really important that we take the time and spend the time with our partners to really emphasize the importance of this. So of course, the counter to dichotomizing symptoms would be to emphasize this really complex interaction of the psychological and physical factors, like we all do, right? But again, just because we know it well doesn't mean that everyone else does. And in truth, it's complicated. It's not an easy thing, although we offhandedly say the biopsychosocial model all the time, easy for me to say. It's not something super easy to understand necessarily. And so my view would be that time is not wasted in collaboration with our partners in reviewing what this means and what it says about how we best intervene with these kids.